Well, hello everybody, and thank you once again for joining us on the weekly United Regional Chamber of Commerce's update. We try and bring you some interesting guests and some local information. And today, I'm very pleased to bring on the CEO of Manet Community Health, the new organization that has just moved into the Bronson Building, or the old Bank of America building. And I'd like to welcome their CEO, Cynthia Seirra. Cynthia, how are you today?
I'm doing well. Thank you so much, Jack, for having me, and thank you for your hospitality and welcoming us to the city of Attleboro.
I took a great tour the other day with Sandra, and she took me through. You've done a great job on half the facility, but we also peeked in across the hall. And I'm going to get to that in a minute, though. We'll talk about the expansion in a minute. Um, Tell us a little bit about Manic Community Health. Where did it start, and what brought you to Attleboro?
Absolutely. Great question. So we started in 1979. We started in the city of Quincy. And we went on to open 3 locations in Quincy and 1 in Hull. And with the mission of making sure that every patient in need has access to health care and supportive services that wrap around that. In 2014, as part of the Federal Health Center program, we opened in Attleboro. And in 2019, in partnership, Jack, with you and with the city of Taunton, its residents, its leaders, submitted an application to begin a journey to be able to serve lives in Attleboro. And it took us a while to get there. We made a commitment to partner with the community and to be there. And so it took us a bit of time, a pandemic to navigate through, and we were really pleased and proud to open with arms wide open from the community, the most amazing staff, the end of July this year. And so that mission carries forward to make sure that no one is left behind. And everyone that needs access to primary care and supportive services like mental health, substance use services, COVID-19 services has a place to go. And we settled on 8 North Main Street, and we're really happy that we're there, Jack.
You've done such a beautiful job. I've been around the Attleboro a week or two, so I knew when it was Bank of America on the branch on one side and the investment group on the other side. You've turned that into some beautiful exam rooms, and there's plenty of space to expand on the other side that I see that you're working on. Tell us a little bit about, give us a minute 101. Tell us a little about the values and the goals that you have for us here in Attleboro.
Yeah, absolutely. And I'm glad Sandra gave you that tour. And we're very proud of the health center and how it's turned out in phase 1 so far. It's absolutely beautiful and state of the art. And I think any patient would want to receive their care there. And so we are part of a statewide and a national system. Here in Massachusetts, 1 in 7 patients receive their care from one of Massachusetts' community health centers. And across the nation, we join the ranks of health centers that are providing care to up to 28 million Americans. So 1 in 11 receive their care at a community health center. And for community health centers, it's such a privilege to be able to partner with the community. Our board, as an example, is majority patients, and want to make sure that we're doing our best to, if you will, treat all the aspects of a patient's life, and see patients from all walks of life. So it's primary care, Jack, and it's folks to have access to what we call continuity care, but it's also that ability to, with the patient in the center, make sure that whether it's episodic or chronic or situational, they have access to mental health services, they have access to specialty care, they have access to recovery and addiction services, they have access to nutritionists and dietitian. So how do we partner with our patients to have them live the most optimal, healthy life that they can? I think what's also very special about Manet and about community health centers is just that word community, that we are and of and by and for the community. And that starts at the governance level. That starts with the fact that we're a very very, very good and proud local employer. So we do our best to hire from the communities that we're situated in, and we take very seriously our partnership with the community. And so, as one example, when COVID came, and so community health centers, Manet, I can speak for Manet, we're not comfortable on the sidelines. However, we can lean in and be part of the solutions, and partner with our public health and our healthcare infrastructure. In Attleboro, of course, Sturdy Memorial provides magnificent service to the community as our community hospital, but a wonderful clinical partner for us. And so we take that significantly as part of our mission that ensures quality, comprehensive care for all, but recognizing that that we do that in companionship with the locations and the infrastructure and the cities and the towns and the communities that we serve, Jack.
Now, folks can come into Manet whether they have a primary care or not, but they can find a primary care through Manet. Am I correct?
Absolutely, Jack. Thank you for that. We have the most amazing team of primary care providers that are accepting new patients, and they're quite magnificent, and they have wonderful, wonderful leadership, and they have wonderful, wonderful support staff at the health center at 8 North Main Street that make them able to do what they do every day. We're open Monday through Fridays, and it's the only health center we presently have that isn't open evenings and Saturdays. So know that once we get there and our patients tell us it's so and so needed, we will expand to evenings and nights too. And yeah, primary care is so important in everyone's life. And I think we have a particular focus on supporting the emergency departments in our area too. And although great utility, incredible structures that are in place, primary care is also intended to reduce those unneeded emergency department stays. There's so much of our care that we can have those needs met inside of that primary care relationship with a physician assistant, with a nurse practitioner, with a physician. So important to be able to promote primary care that takes care of both your, if you will, your sick care, your episodic care, but also your preventative care, right? And also your disease management, and nurses that are really dedicated specifically to diseases that our patients may have, to help keep you out of the emergency department and help keep you out of the hospital. What care we can provide that's going to help manage your diabetes during the course of the year, help keep your hypertension managed and safe. So primary care. And I think in pandemic, Jack, one of the positive outcomes about a worldwide pandemic is, I think, further reflection for folks and families and community residents of how important it is to have access to healthcare. And so that it's always there for you. But I think, Jack, what's important is we're accepting new patients every day, and we're here to serve. I mean, that's why we came to Attleboro. We exist to partner with the community and to meet those needs that might be met. And if you're from a contiguous community to Attleboro, we're asked to serve as well. So if you live in the bordering towns, we're here to serve. If you will, our service area is Attleboro, but it's also the communities that are around that. So thank you for the question, Jack. It's a really important one.
Well, one of the things that you did mention is this crazy pandemic that we've all been going through for almost the last 2 years. And I know that I think it's Thursdays, you are doing some COVID vaccinations by appointment, but people can make an appointment to come in and see you just about any time. Am I right?
Absolutely, Jack. And Sandra McGonigal was so good to remind me before we went on live about our community vaccination clinics. And you're absolutely right. Every Thursday from our website or to call 508-205-4600. Our website is manetchc.org. To ensure your place in the vaccination clinic, we would prefer that you book online or you call us, and we'll give you an appointment slot. Such high demand, so critically important to come for your first dose, your second dose, your booster dose, and know that we have access to Pfizer, Moderna, J&J providers that will talk you through that process. And yes, for primary care, call us. We're there to serve. I mean, we're there to serve you. If stopping in at 8 North Main Street feels more comfortable for you to meet our patient service representative and to book in person. If again, calling us or our website, particularly around COVID services, we're here to serve. Jack, I think the COVID-19 vaccination model, open model for the community is so important because it gives you a chance to see our site and to meet our staff. And to ask any questions that you might have about primary care or the provider team or the services that are happening right now at 8 North Main Street.
Well, also a question that always pops up when anybody's talking about their health care is insurance. What insurance carriers do you accept?
It's a great question. I'm glad that you asked, Jack. There are very few insurance carriers, or what we also call payers, that we don't accept. So whether it is a commercial product, if you will, for employer-sponsored plans, whether it's through the Commonwealth Connector, whether it's a Medicare plan, whether it's a Medicaid plan. Jack, I think what's really important to impart to your viewers and your listeners is that no patient is left behind at what's called a federally qualified health center like Manet. And here's why. We are dedicated and driven to be part of the health safety net. So for patients and community residents that don't have access to healthcare, health coverage, we have navigators that help connect folks to coverage. But if you are a patient or a person or a family that needs access to what's called the health safety net coverage to ensure access to healthcare, federally qualified health centers in the Commonwealth of Massachusetts like Manet, we are your health safety net provider. And so come and see us, and don't at all be concerned about the coverage that you would be calling or entering the health center with. If you're eligible for coverage, we're going to do everything that we can to make sure that you have confidence in that coverage, but also connect you to the health safety net if you are in need of that plan as well. So thank you for asking. So all are welcome, Jack. All are welcome.
You know, you have such a fabulous staff over there, and they're so willing to help folks. Like you just said, navigate the crazy insurance systems and the state programs that are out there. That's very confusing to just about everybody except for you health professionals. But let's get on a positive note for a minute. Tell us about the exciting upgrades and expansion that you're going to do there at North Main Street.
Absolutely. When you move to new communities, you have to prepare for the ability to further expand. And 8 North Main Street, and Jack, I don't know if you remember in 2019 and the arm that you extended to me, and we toured the city.
Yep,
And
I remember.
Do you remember that?
Yep.
Yeah, and you showed me some great places to be, and sort of as the new person on the block, found that incredibly helpful, and arms around other service providers and health colleagues and city staff, and we found our way to 8 North Main Street. And Jack, what was important to us was the ability to be able to expand. And health centers can expand, if you will, across the street or a little ways down. For Manet, we've always found it best for our patients if we can put all of the services that we deliver, including mental health care, recovery care, medication-assisted treatment, dietitian services, nutrition, case management, psychiatry, primary care in one location. And so we found that in 8 North Main Street, and we have a phased approach to our expansion. So if you were going to come and see us today, we have just a beautiful facility, as you referenced, and exam rooms. That space, soon enough, Jack, won't be enough because we want to be able to bring a multifaceted team of professionals and licensed clinical social workers, as an example, recovery medication assisted treatment nurses, dietitians, nutritionists, prenatal case managers. And you need space to be able to do that. So in the winter of 2022, we will be in December moving into some meetings towards the end of the month, what that footprint looks like on the other side of the lobby at 8 North Main Street. And exploring, what does that floor plan look like? And what are the care teams, and how are we going to juxtapose them together? And how do we create, if you will, a flow and a floor plan that's going to be most pleasing and convenient for our patients? And know too, Jack, that at Manet we see newborn infants all the way up to post centenarians, and so we keep that in mind as well. But I think that space, it's pedestrian friendly, it's first floor space, it's close to sturdy memorial, it's close to a lot of your community assets, and I know the folks and the entities and the businesses that you partner with really well. So we're very much looking forward. We're really pleased and proud of this startup year, but very, very eager to grow the space on the other side as well.
Well, this is just another tremendous resource for the city of Attleboro and our surrounding communities. And we hope that you folks take advantage of that. They've got a wonderful staff. I was there the other day. I got a chance to chat with some of them. And Sandra McGonigal took me through and showed me the facility. And like I said, we peeked into the other side where the construction guys were getting everything ready. So we're really excited to see you open up. And we're going to do a big ribbon cutting when that side opens. I know you kind of opened up on a soft key in July, but it is just a tremendous resource for the community and for all in our area. So, Cynthia, any last thoughts before we close it out today?
Jack, just appreciation, and I can't wait to have that ribbon cutting and to have you there by our side for that. Appreciative for what you do. We're truly honored and privileged to do this work for the community, and just over the moon that we have the chance to be in Attleboro. So we welcome anyone for care. We welcome anyone to give us suggestions of services and programs that would speak to the community of Attleboro, and know that we say that with such sincerity that we're truly in service to you and the community.
Well, thank you once again for taking the time to come on the show today. Hopefully our listeners can take advantage of the great resource that we have there in downtown Attleboro. Reach out to your staff, talk to them with any questions or things that they might need. So, Cynthia, thank you once again for coming on the show. Folks, thanks for viewing in today. We hope to see you again next week. Next week, we're going to bring on some folks from the ARC of Bristol County, and we'll talk a little bit more about those. So thank you, everybody. Please be safe.
Thank you.